Anatomical positions. Anatomical position. Anatomical position. Body erect with feet together. Arms at side with palms forward. The anatomical position is the common visual reference point. Anatomical position. The terms right and left always refer to the person, cadaver, or skeleton being viewed and are not the viewer's right and left, directional and regional terms. There are two fundamental divisions of our body: axial, head, neck, trunk; appendicular, shoulder, arm, pelvis, leg. Directional terms. Superior, inferior. Toward the head end or upper part of a structure or the body. Inferior. Away from the head end or toward the lower part of a structure or the body. Directional terms. Anterior, posterior. Toward or at the front of the body. Ventral. Posterior. Toward the back of the body, behind. Dorsal. Directional terms. Medial, lateral, intermediate. Toward or at the midline of the body. Lateral. Away from the midline of the body. Intermediate. Between a more medial and a more lateral structure. Directional terms. Proximal, distal. Closer to the origin of the body part, or the point of attachment of a limb to the body trunk. Distal. Farther from the origin of the body part or the point of attachment of a limb to the body trunk. Directional terms. Superficial, deep, toward or at the body surface. Away from the body surface, more internal. Superficial. Deep. Ipsilateral. Contralateral. Body planes and sections. Copyright 2013 Pearson Education Incorporated. Body planes and sections. Body plane. Flat surface along which body or structure may be cut for anatomical study. Sections. Cuts or sections made along a body plane. Body planes and sections. The most frequently used body planes are sagittal, frontal and transverse, which are at right angles to each other. A section bears the name of the plane along which it is cut. Body planes. The frontal plane divides the body into anterior and posterior sections. Also called a coronal when referencing the head. Body planes. A transverse plane runs horizontally and divides the body into superior and inferior sections. Transverse sections are also called cross sections. Body planes. The sagittal plane lies vertically and divides the body into right and left parts. If the sagittal plane lies exactly at midline and it is referred to as the medianormant sagittal plane. Parasagittal plane is the division that is no on the midline. Body planes. Cuts made along any plane that lies diagonally between horizontal and vertical are called oblique sections. Oblique sections are rarely used because normal planes of reference are not evident. Body cavities. Two sets of internal body cavities. Copyright 2013 Pearson Education Incorporated. Body cavities. Two sets of internal body cavities. Closed to environment. Provide different degrees of protection to organs. Dorsal body cavity. Ventral body cavity. Body cavities. Dorsal body cavity is divided into a cranial cavity which encases the brain, and the vertebral cavity which encases the spinal cord. Body cavities. The ventral body cavity houses the visceral organs. The ventral body cavity is divided into the thoracic, abdominal, and pelvic cavities. Thoracic cavity. The thoracic cavity is surrounded by the ribs and muscles of the chest. It is further divided into pleural cavities, mediastinum, pericardial. Ventral body cavity. Thoracic cavity subdivisions. Two pleural cavities. Copyright 2013 Pearson Education Incorporated. Ventral body cavity. Thoracic cavity subdivisions. 2 pleural cavities. Each houses a lung. Mediastinum. Contains pericardial cavity. Surrounds thoracic organs. Pericardial cavity. Encloses heart. Abdominopelvic cavity. Abdominopelvic cavity lies below the diaphragm. It is further divided into abdominal cavity, stomach, intestines, spleen, liver, pelvic cavity, bladder, rectum, and some reproductive organs. Membranes and ventral body cavity. Copyright 2013 Pearson Education Incorporated. Membranes and ventral body cavity. Serous membrane or serosa. Thin, double-layered membranes. Parietal serosa lines internal body cavity walls. Visceral serosa covers internal organs, viscera. Layers separated by slit-like cavity filled with serous fluid. Fluid secreted by both layers of membrane. Copyright 2013 Pearson Education Incorporated. Serous membranes. Named for specific cavity and organs with which associated. Each has parietal and visceral layers. Pericardium. Heart. Pleura. Lungs. Peritoneum. Abdominopelvic cavity. Serous or pleural cavities. Serous or pleural cavities are open cavities but rather slit-like in appearance and dimension. The cavities contain a small volume of a serous fluid secreted by the membranes. The serous fluid allows the visceral organs to slide with little friction during routine function,